Did you know one simple exercise can drastically change how your body looks and feels in this video? I'll show you the exact exercise that has helped hundreds of my patients move and feel like they're 20 years younger, and it can take as little as 12 weeks. But first, I want to show you the number one reason why our legs get weaker or more painful as we get older. It's something I wish all my patients knew earlier. It has to do with sarcopenia, the gradual loss of muscle that starts in our 30s but accelerates after 60s, impacting our legs, back, hips, and knees, all crucial for staying strong and independent. But here's the good news. A groundbreaking 2024 study shows that we can reverse sarcopenia with one simple approach: progressive strength training, PST, which is a simple science-backed approach to rebuilding muscle and strengthening our joints. And the best part, you can see results in just 12 weeks. Pacific Standard Time is actually the reason why a lot of 70-year-olds move like they're 50 now. If you want to learn more about PST, I've created a free printable guide with a step-by-step breakdown and photos and instructions from today's exercise. You can download it now. Just click the link in the description below. Okay, let's jump into the number one leg strengthening exercise that works for all fitness levels. Even if you have arthritis, start in a chair feed, shoulder width apart. We are going to target the three biggest muscle groups that you use every single day: your quads, your glutes, and your core. And we can target all three with just one move from a sitting position. Scoot forward so you're near the edge of the seat. Move your feet slightly back behind your knees. Now, two options. If you feel stable, keep your arms in front of you. Or option two, if you need support, use the armrest or push off from the seat. From here, engage your quads, glutes, and core as you push up into a standing position. Once you're standing, making sure the chair is still behind you, slowly lower yourself back down. This is called the slow sit stand or a chair squat, and it was recently named the number one exercise for older adults by researchers at Tufts University because it improves walking, stair climbing, and daily activities like standing up from a chair, using the toilet, or picking up objects from the ground. Now, the key with this exercise is to go up to the count of 2 fairly quickly, which builds power and speed. But when you come down, doing it slowly to the count of 4. This slow contraction is what builds muscle mass and strength. But here are 3 big mistakes you need to avoid with this exercise. Number 1, letting your knees cave in. Keep them aligned with your pinky toes. Number 2, feet too far forward. Remember to move them behind your knees for better leverage. And number 3, trying to stand up straight without bending forward. This puts unnecessary pressure on the knees. Which brings me to a very important question. What if it hurts? If you have knee pain or arthritis? You might have been told to avoid squats altogether, even by your doctor. But here's the truth of avoiding exercises like the squat or sit can actually make things worse. You see, even well-intentioned doctors still tell patients with arthritis to never squat because they think it puts too much stress on the knees. But the latest research shows that properly performed squats can actually reduce pain, strengthen the knees, and improve mobility. What's amazing is that exercise is beneficial even if you have severe osteoarthritis or if you've been told you're bone on bone. The key is to do them the right way with the right technique, depth, and modifications for your current level. For that reason, I've created a simple FEP system to make this exercise pain-free. Step 1, find your natural stance. Your toes don't always have to point forward. If a slight outward turn feels more comfortable, go with that. Even for me, I get much better activation of my muscles with my feet and toes turn out, and it just feels way better. Step 2, use proper technique. Remember, hinging forward at the hips before standing and sitting down, and also keeping your knees aligned with your pinky toes. You can shift your weight slightly based on what feels best for you. More weight on your toes activates your quads. More weight on your heels engages your glutes. Both are effective. Choose what feels most comfortable for your body. Step 3, pick the right variation. If you want to make it easier, you can hold on to a sturdy chair and do a mini dip, only lowering a few inches to make it harder. Try a full squat without a chair or hold a weight for added challenge. Maybe not like this to start anyways. This brings us to step number 4. Getting the right volume. I typically suggest 10 reps, 3 sets with a 1-minute break in between 2 to 3 times per week. However, this is a guide. You may need to start smaller, maybe 5 reps, 1 set per day. and gradually build up. This is especially important if you've had a recent surgery to your back or your legs, which brings us to the final step. Step number 5, a simple trick for pain management. Now, I always tell my patients, sore but safe. A little soreness is normal when starting an exercise. Your muscles will adapt within a few weeks. But if pain is still holding you back, use the simple 0 to 10 rule. Pain plus exercise intensity should add up to 10 if you have high pain. 7 out of 10, for example. Keep your exercise intensity and effort that day low, maybe a 3 out of 10. If you have low pain, like a 3 out of 10, you can maybe push your intensity of your exercises to 7 out of 10. This way you can keep moving safely without overdoing it. Now remember, avoiding squats might feel like a safe option, but over time it leads to weaker legs, more joint stiffness, and greater difficulty with daily activities like getting up from a chair or climbing the stairs. That's why this simple exercise is one of the most important movements you can do at any age. Now that you've mastered this powerful leg exercise, what if I told you that just 10 minutes a day could take your strength to the next level? Click on this video here where I'll guide you through a simple and effective 10-minute routine designed specifically for anyone over 60. Don't miss it. I'll see you there. Remember, small efforts every day lead to big results. You're not alone on this fitness journey. We're with you every step of the way. If you enjoyed this video, hit that subscribe button and join our fitness family. See you in the next workout.